Welcome to the Regional Health Solutions podcast, powered by Statham.
We're your hosts, William Munt and Jaden Frame.
In this episode of Regional Health Solutions, we have a brilliant conversation with Jason Eldering, the CEO of Southern Cross Care Queensland. Jason began his professional life as a golfer, so he tells us about how he went from there to a career in aged care. With a staff of over 1,300 people, SCCQ provides compassionate care and support to over 2,600 individuals across 13 residential aged care homes, 5 retirement villages, and over 1,200 home care clients in metro and rural Queensland. Jason's work with SCCQ gives him unique insights to share about regional health solutions. In this conversation with Jason, recorded in mid-2024, we discuss the challenges with aged care in Australia right now, how he sees it evolving over the next 10 years, the economic benefits of health and aged care facilities in regional towns. We discussed the $36 million Southern Cross Care project in Chinchilla, which at the time of recording was still being built but is now operational as of 2025. We also discussed why partnerships are key to success in regional initiatives, such as the one with SCC and the Western Downs Regional Council. We discuss the need to prioritise relationships, community and social aspects in not just aged care but healthcare and life in general, the challenge of navigating complex healthcare systems for older Australians, the fragmented healthcare continuum and the ways a combination of political will, funding model changes and more proactive collaboration could unify healthcare delivery, and other topics. We hope you enjoy the podcast, and we now bring you Jason Eldering. Jason, thanks for joining us on the podcast today.
Thanks, Will. Thanks, Jaden.
I know we've talked off air that you're an avid golfer and you've had a bit of a journey into the aged care sector. Do you want to give a brief summary maybe of what that looks like and how you found yourself in the seat here at SCC?
Yeah, it's a good question. So golf was an early passion, loved it, and became a golf professional at the age of about 21 and played around the Australian circuit. Wasn't very good, so got into coaching and found myself coaching and ended up at a golf club in Melbourne called Yarra Yarra, and where I was the head professional. And through that journey, obviously you get to meet a lot of different people. But also, I suppose, I continued to study. I was always a person who liked studying and liked learning. So during my time at Yarra Yarra, I was doing a thing called an MBA, and one of the students there was a guy called Brian Dorman. And Brian owned a small aged care group at that time called Regis. And so Regis was had about 800 beds and became probably one of Australia's largest now. It's the only last listed aged care entity on the stock exchange. And Brian saw something in me and said, "Mate, why don't you come and join aged care?" And I remember the conversation. I said, "Brian, I know nothing about aged care." And he goes, "Perfect." And it was sort of like one of those moments in life where you sort of take a leap of faith. And I think that's in life, a lot of us need to take leaps of faith. And so to leave something I was pretty proficient at in terms of golf and then move into this thing called aged care and join Regis in 2002.
Fascinating story, Jason. Moving into aged care, we know in Australia there's a lot of challenges, and particularly in regional and rural and thin markets. Jumping straight in, where do you see aged care in 10 years' time?
It's a good question. Look, having travelled around the world, I just come back from a bit of a study tour last year. I had a look through the UK, Netherlands, over to Switzerland, having a look through Zurich. Look, I think aged care, especially in the rural and remote, regions, is tricky. I think, given the geographic spread of Australia, I think the solution the government's had on home care possibly doesn't work. I think it's got some real challenges. I think home care as a solution to this is potentially problematic. And if we don't think that through that correctly, we could end up having people staying at home, especially those who are isolated, single occupant in a home, and you're getting home care in a typical week. I think it's about 168 hours from memory. If you're getting, say, 10 hours a week, there's a lot of time for isolation. So I think home care has an opportunity. You could use technology in the bush. I think there's some, good organisations doing that. Groups like Gundyr have done some good work in that space. But I still think isolation's a big issue. So I think home care is an interesting one we need to understand. And I think if we don't get that right, the issue is those good folk living independently with some home care can have adverse health outcomes that potentially move them into hospital probably a bit quick. And then the hospitals don't know how to deal with it, and then they basically push them across to a thing called aged care. So I think we need to really have a good think about how do we create communities inside our regional and rural remote towns. I think it's problematic given the view of home care, where home care sits at the moment, and the travel around that as well is problematic. How you do that efficiently, I think it's got some real questions. So I think our vision at Southern Cross Care is we talk about growing communities where best lives are lived. So we want to make sure that how do we listen to communities, how do we engage with communities and sort of come up with better solutions than the current linear solutions that are in place. I think there's a model there that needs to be sort of explored and unpacked, but it's not a simple solution for the bush.
Mm. And geographic dislocation is obviously the biggest hurdle here, other than workforce and how that's fragmented. But if we talk geographic dislocation, is that, without leading you down a thought path, is that where you're thinking that these guys come together and we reimagine how that looks in terms of a community-based aged care facility that isn't purely aged care? It's not a retirement village, but there's a spectrum of care that scales up.
Yeah, that's exactly right. And I suppose, an example that would be Chinchilla, where we are at the moment. We're rebuilding out there. But if you think that, the 81 beds at Chinchilla, which we're rebuilding, is the solution, we're probably missing the mark because it sort of prematurely puts people into aged care. You probably remember this, in 2014 we had this model called low care. It was called hostels.
Yeah. And
it was a really good model for a lot of people that had, some care on site. It was always manned 24/7. It wasn't a clinical model, but it was definitely, you're able to get, good management of your medications, you're able to see a doctor, nurse when required, but you sort of had good social support too and a lifestyle. So it was really lovely. And sort of aged care was born out of that. There was always nursing homes that were really high end, but there was a separation between the two. So in my view, what's happened, unfortunately, is we've lost that low care. It's really disappeared. So you're either in high care, retirement, there's not enough retirement in the bush. There's just not enough solutions out there. So I think your point's right. I think the idea, if you could create a community where people could come to live together, live their best lives, have purpose and connection, also maybe even pop back out to where they live. There's no reason why that can't exist. And I think we've got to be really flexible with providing contemporary care services and accommodation services in the bush. I think if we keep going the way we are, if we prematurely put people into aged care, which is I think is a problem. And I also think we could do a disservice if we think that home care on its own is going to be the solution. So those two things are okay, but there is something I think in the middle that we should explore as communities and as governments and as leaders as we sit around thinking about what does this look like.
Is there a blended model there that you see with workforce, potentially, knowing accommodation is a huge pressure out west, and the way that our residents and then potentially patients that end up in hospital come back out into, they flick between the residency and the patient stream quite often, as we know. Is there a blended model that has workforce and the residents almost living together in a community style arrangement?
Absolutely. Oh, look, if you ever look, there's a great organisation in Zaandam that has been providing care. This is in the Netherlands for 350 years, and one of their communities got about 800 people live there, and of the 800 older people live there, 10% of that population is accommodated staff. So the staff actually live on site with the residents. And look, I think anything where you can create intergenerational living, we have better communities. It's sad to think that we just isolate or silo people up into buckets. We're always better when we're together. We must give thought to our aged. There's wisdom there to hand down to the younger generations. I think, I get really inspired by the stuff, the 4-year-olds in aged care. You think about those stories and think, why can't we build communities where people can live their best lives? It's not a clinical model. It's very much a human model that says, hey, you can come and live and be with us, not in a sort of a hospital. I don't know anybody who wants to live in a hospital. I'll be very honest. It's and unfortunately aged care sort of pointing in that direction, with mandated care minutes and so forth, which are all important. All that effort's important, but it's when you live, you want to live a life. It's a home, and there's things that sit within communities that should give you independence and some autonomy in what you do. So I'm a great believer. I think there's a great solution for regional and remote Australia, but it's going to take some effort. It'll take effort from government. It'll take effort from providers like Southern Cross Care and others who are in these regions and rural communities to think a bit differently about it, but to also respect the individual. And I think that it's got to start with a conversation and say, how does your best life look if you can map this out? So, things like isolation lead to mental health. There's some real issues that we need to sort of work through, but the only way we can do it is by listening to community.
Jason, you're part of an ecosystem in health in rural and regional. So you've got the aged care, you've got primary care, and you've got the hospital sector. What do you think is the biggest problem in regional and rural Australia when it comes to healthcare? What is the biggest problem that you see right now?
Oh, look, you'd have to say workforce is number one. It'll be the massive challenge. I think getting people out to the bush is tricky. People are attracted to the eastern seaboard or maybe WA. So I think workforce, and then I think that if you put that together with limited housing solutions, I think housing is a problem. So I think you've got workforce, housing, and probably some access to health services. If you look at the CFA index, which is the ABS looks at those who are advantaged and disadvantaged. You can look at Australia and see that once you go past the eastern seaboard, you sort of get past the west of the Great Divide, it starts to look a bit tricky. And so I think if we could have better housing solutions, better infrastructure, I think people can live great lives in the bush. And one of my views is I'd be encouraging people to get out there. The good work that people like the Western Regional Council do. Livability is a biggie. You think, crikey, you can live your best life out in the bush. It's really, really good. You can raise kids. So we're advocates for it, and we've seen some great stories where staff, come on board and move out there and love it. To me, it's really, we know the workforce issues. Net immigration went down through COVID. We got banged around there. Then supply, demand issues came into it. And so everybody started, you're chasing it up, and it's been tricky. But workforce, mate, would be it for me.
And we believe that the livability of a region is dictated by or underpinned by the healthcare system. If you have a strong healthcare system, the livability goes up. Can you go into what Southern Cross Care are doing in Chinchilla in particular around that workforce solution and what you're doing innovatively? Because the things that you're doing out there is pretty exciting.
Yeah, look, I suppose for us, it's, we've got great partners, so groups like Southern Queensland Rural Health, Professor Jeff Argus, amazing leader and thinker. What we've been able to produce out there is a step in the right direction with giving sort of a direction and hope to young health professionals coming through a system. And I think that's a step in the right direction. So I think it gives hope to the young kids. I've done talks at the Chinchilla High School and even events where you go and talk to the kids and say, who wants to stay in Chinchilla? A lot of them want to go and travel, but a lot of them also want to come back, but they want to come back to meaningful work. So I think if they could see things like SQRH and go, wow, there's a pathway through health for me. I remember 1 in 4 kids had their hand up for health. So it's pretty exciting if you thought about the young people coming through. If we can engage them, I reckon that's an absolute solution. The immediate is obviously real. So we've got partnerships with Papua New Guinea government. We've brought in the Palms workers, so that's been a wonderful thing. They've integrated into our communities. So I don't think there's one silver bullet. It'll be unfair to say that. I think it's a lot of effort in a lot of different areas. You need good organisations like the Western Regional Council, groups like Statum, around thinking about how do you create workforce. But I don't think there's one solution. I think it's just a lot of effort in a lot of different directions. And again, it'll be the lived experience of the people. And I think integration into community, it's about, if you could maybe find love in the community, that's always a start. Or if you could, get involved with the sporting clubs. But I think it's how we integrate people and they feel assimilated into those communities that makes the big difference. Because they can be lonely as well. We would be really mindful of that, saying, we want to build communities and let people live their best lives. So no silver bullet, but a lot of effort in lots of different directions.
And without politicising this, obviously funding and policy sits at federal and state level. Going down a layer further, you mentioned council's role in how they can incentivise some of these things. You can definitely have private initiatives, which we've heard of. Where does council's role sit in amongst that to help that community?
Look, for me, where council can sit in, people like Jodie Taylor at the Western Downs Regional Council, a really good lady in terms of thinking about, partnerships with housing. I think housing's a biggie. I think if we could get better housing solutions, because the biggest issue in Australia at the moment, let's be honest, is cost of living. It doesn't matter it doesn't matter where you are, especially in metro. It'd be good to do some analysis, wouldn't it, to think about, is the cost of living easier in the bush than it is in metro? I'd say yes, but again, don't know. But that needs some thought. I think there's some real advantages. If I wanted to raise a young family today, I'd be heading to the bush. Housing affordability is amazing, but I think we've got to get more supply of housing and appropriate housing into the markets. That's where regional councils can play a big part. Infrastructure cost, headworks cost, anything that they can do to assist and make it more affordable for young people to get into that market, even older people. I think council can play a strong role in that space. So, and they've done some great work, investment in community infrastructure. You think of parks and gardens and all the things that people want to do on weekends. There needs to be other things to go and do. So I think the livability of a city or its community is also about the infrastructure that's in that community. So for me, I think council can play a really big role in supporting really good infrastructure and affordable infrastructure so that it's attractive to investors and making sure we're getting investment in those areas.
If you rewind 4 years, the relationship that Southern Cross Care Queensland and the Western Downs Regional Council have at the moment is really strong, and the solution you've provided to that region has been fantastic. They're not Robinson Crusoe, so if you had to give other regional councils some advice on what Western Downs Regional Council did well in the early pieces, what would it be?
Yeah, look, Paul McVeigh was outstanding in that space. Remember, we took on Tara and Miles, two little homes that were probably struggling. They were looking to close down Tara. And look, and Tara's still there working, today. So the advice I'd give anybody if they were talking about council is to find a good partner, but it's hard. You've got to find somebody you want to work with. It takes effort and it takes joint effort. And I suppose we had a sort of meeting of the minds, aligned effort between Jodie Taylor and Paul McVeigh, Paul Smith, all those people were pulling, the councillors were pulling in the right direction. We had effort. Even people like David Littleproud, the federal member out there who does a great job in terms of advocacy, but also where, government can come in, they can advocate for us. We get federal government support to go and do things like we did at Chinchilla. We've had about $17 million, just from a aged care federal grant piece. But on the other side, you need an organisation who's got a balance sheet. So we've been able to put another 17 in as well. So all of a sudden you've got a $34 million asset being built at Chinchilla. It's really, quite amazing to think that that's even got off the ground, the effort it takes. But what it does do is you need alignment between local, your state government, your federal government, all pulling in the right direction. A really good provider who's committed to it. So somebody who's had long-term experience and sort of a passion for it. And they're there for the right reasons, and I think if you get that done, you're a chance to do some pretty good stuff. And I think Chinchilla's going to be an example. Allura, the community out there is going to be a great example of something that's going to make a big difference. And I think it could be could even be replicated around Australia as a sort of a model that could support broader hub and spoke models. And I think that's, we see Chinchilla as a hub. And it's even able to push out and support other local communities. When I say local, probably 100, 150 k's away. So I think that's the benefit of partnerships with government at every level, but also a provider with the capability. It always comes back to capability, capacity. You guys know that as thought leaders and leaders yourselves. You still need the effort and the ability to go and do things. So that's probably how I see it, mate.
And the project in Chinchilla is fantastic. And we've talked about health outcomes and the benefit to community. When you've got a $35 million project, generally in those regional towns, the aged care facility is one of the largest employers.
Yeah.
But that economic benefit and the flow-on effect to the local, food works, to the coffee shops, to the gyms, it's something that sometimes gets lost in the bigger picture when we're talking about care and healthcare. It does underpin the livability of a region, and making sure that your providers are sustainable is huge.
Yeah, look, it's a great point, and it's just reflecting and thinking about places like Taroom. For example, the township of Taroom, where we are, Southern Cross Care's got effort out there, 29 beds, Leichhardt Village, and you go, well, we've got 40, 50 staff employed out there. Now, we would be, that the township of Taroom is probably 500 in total, thereabouts. So 10%, it's a lot of effort, so the effort that goes through there does keep the IGA open or the food works open. It keeps the schools going. It's sort of, there's an interconnectedness, isn't there, with all of this childcare all the way through. So we think that there's a real, there needs to be a focus on economic growth. But I agree with you. Chinchilla, it'll employ 100 people out there. It'll be, and it's long term. We hang around these places. You're in there for 40, 50 years, as we've been. So it's so worthwhile. I think the thing I get really excited about is there's an honour to the aged. That's all aged. It's our First Nations people through to, Australians. Everybody who comes and lives in this beautiful country of ours deserves a good, sort of a good death. We could say that. That's an important part. Nobody really talks about death in this country, but at the end of the day, you want to feel loved, you want to feel known, you want to know that somebody's got your back, and you need great clinical support, but somebody's like a community that's got their arms around you. So it's really important. I think, things like palliative care and dementia, which we haven't spoken about much today, are really important in those environments too. So, we play a big role in our society, and this is important work that Southern Cross Care does, but also all the other providers in these regions. There's a lot of good effort goes on and should not go unrecognised. The staff who do the work 24/7, the RNs who roll their sleeves up to get to work, food services. It's a massive effort to look after somebody 24/7. And I've just got, as I said, here, CEO for Southern Cross Care, I got absolute praise and thanks for the effort, the local effort. Leaders, people like Lance Payne, who's been out there at Chinchilla, the work he's done, the effort that it goes into making these things fantastic. It's like, God, we should be thankful that we've got to inspire even some more. I think one of our things we should think about is how do we inspire young leaders and even old leaders to step up, because this is a community effort. We're only a partner in the community. We don't own it. We see ourselves very much as somebody's just a partner out there. We've been invited in by the community. We sit there, we provide, but it needs to be the community.
Community and relationships are the theme in reality, aren't they? And we've read Blue Zones and we've read Outlive, and the secret to longevity really are those partnerships and relationships, and not only longevity but quality of life, and probably more of a statement than a question.
You're heading down the track maybe of that great Harvard study, a good life. It comes down to, as you said, Will, it comes down to great relationships. If you've got good relationships, the quality of your life will be determined by the quality of your relationships. We're social creatures. We want to be around people. We want to, and so if we can create environments where people can come together and live their best life, have relationships, the relationships the staff have with the residents and vice versa. Some amazing, stories in home care. As I said, home care is fantastic. You pointed to the Blue Zone, but the home care only really works when there's 6 people around that person. So if you've got somebody in the middle, you still need 6 people. Obviously, it could be daughter, son, a couple of best friends and a community provider or a home care provider. If you've got that, you're away, you can do okay. But if you're only relying on the aged care provider to provide the home care and you're on your own, it's tough. So you're right, there's a social fabric there. And the Blue Zone spoke about that. They said that where they found the happiest and healthiest, longer living people, they did have 6 people around them. If you look at that Netflix show that's on there, it talks about the sort of the 100-year life where Dan Buettner went through and spoke about that and presented it. It was, blown away by the family. The older person was there and they could talk about grumpy old Jason or ever who it was, but there was a group around him. That's where I think we could make a big difference in creating new communities and having an ability to connect people, because our quality of life will be determined by the quality of our relationships. The Harvard study proves that. It's the longest longitudinal study in the world, going over 80-odd years, and they can prove that the quality of our happiness comes down to the quality of our relationships. So you think about that in a community. So it all gets down to, I think we shouldn't get too far away from that.
Zooming out and looking at the industry as a whole, talking about that the push should be toward relationships and having a more social consideration of our residents and the whole community. Is that the trend that everyone is thinking down that path, or are we off the back end of a no doubt much needed commission, but we've clinicalised aged care to a point now that it's heading in the direction of subspecialisation, much like an acute sector, and actually moving farther away from that social aspect, or is it not past the point of no return? What are your thoughts on that?
Great question. Look, clinical services are fundamental to it, but they should be there but not front, if that makes sense. If it's all a clinical model, like a hospital is probably a great example of a clinical model, but none of us want to live in a hospital. So I think, to me, we want to know there's good clinical services there. So I think the Royal Commission pointed us in a direction of saying, look, we need mandated care minutes. Absolutely agree. That's all correct. But it shouldn't be the driver. It should be the supporter. So it should be seen, or it could be almost, it's just there as I need it. It's a bit like when I need the GP. I go and see the GP. But if it's driving the environment, it could become like a hospital, and I think that would be detrimental to the overall health and well-being of our older people. Because I think they need to live in homes where home has normality. It's not a hospital. And a home, there's joy, there's love, there's laughter. There are times you'll be sad, but it's very much a social fabric. And I think what I've seen on my travels, extensive travels, I've travelled all over the world looking at aged care models. The ones that warm my heart the most are the ones that are based on social and community, and they've got good back-end clinical support. If it becomes clinicalised, I think we could end up in a space that's not best for the residents. I think that could be something that would not upset me, but I would probably say to me, we're not heading in the right direction. I think Adol Grande's book, if you could think about being mortal, and the references he made inside that we're talking about people like Dr. Bill Thomas, who was really one of the great thought leaders around the Eden's model, the Eden's alternative. And Bill was a GP, went into an aged care home and couldn't believe that all the clinical data he was reading. The polypharmaceuticals were through the roof, and he was looking at sort of fall skin tears. He was like, "This is all terrible." And he was looking around. And he thought, "No wonder this is not the environment for him." So he started to introduce birds, plants, normal living, and all of a sudden they had purpose. And I don't know. I think people like Bill Thomas, the Eden's alternative should be a sort of a philosophy that underpins our ageing. It should be about living, because if you can't live well, you can't die well. They go sort of hand in glove. And I think Grande speaks about it so beautifully in his book, Being Mortal. I think they spend 25% of the health budget in America on the last year of life. And I'm like, wow, what's that about? So is that where we are?
Yeah, wow. Is that right?
That's what it is, yeah. It's as high as that. So what happens is if we don't have a proper conversation, we need great clinical thinkers and people to talk about what does your best life look like. And I think we sometimes lose hope. And the thing for me that I love about Southern Cross Care is that we can be great at our clinical services, but we can create beautiful communities where people can have great relationships. And what I do hope, mate, is really we start to see an increase in volunteers into these groups as well. I think, volunteering needs to be at the heart of it as well. Look, I've got great hope for especially the bush. I think the bush can do it better than anybody else, because the bush understands that it takes effort to roll your sleeves up and you wear multiple hats. You could be the fiery, but you're also the paramedic. You could be the registered nurse. We all understand it takes local effort. So anybody on this who's listening, read Being Mortal. It's a classic.
Jason, if you were sitting in front of decision makers in Canberra now, and you've just alluded to it could be a community solution, but if you were the Prime Minister or a decision maker, what advice would you be giving them to help the aged care sector in regional and rural Australia?
I think it's got to start with listen. You got to listen to the community, and I think what happens is at times we jump to solution too quickly. We don't really have a proper conversation. So we had a lady here who worked with us, Dr. Gabby Fernando, who was really fundamental for where Chinchilla is today. You know, I said, Gabby, we've got this place called Chinchilla. We're sort of like not sure. It's got an old home, but I'm not quite sure what the community needs are. And she said, I'll go out and understand it for you. And she went out and she did a lot of community research and discussions. And she came back to me and said, Jace, pretty simple. She said, you know, health literacy is a big issue. So health literacy in that community is really low. So they don't even know how to get even some health services. Could be aged care, home care. They don't even know. There's things called My Aged Care that are like, how do you even use the internet? You know, so if health literacy is low, I think that's one thing. So I'd be saying to government, how do we support our regional and remote community? So again, health literacy. Transport's a massive issue in the bush. So how do you get to and from? So one of the issues they spoke a lot about was, you know, the Darling Downs Hospital, which does great work, living in Chinchilla is a couple of hours away. How do we get there? And then appointments get changed and started. So they would say you've got health literacy, transport, how do you deal with that? And then access to services. So the access to services would be GPs. How do I get access to that, especially with, you know, the changing, I suppose, world around co-contributions are changing. So do we cause a bit of an issue if we're not careful? So I would start with listening. I would want to make sure we listen to the community, put some ideas forward, such as I've suggested. I don't know, people might want to do some community housing, but they might want to come in and stay with us for 2 weeks and then go back to their home for a week. I don't know. There's got to be flexible models that support people in their best lives. But I would start with listening. Governments typically, they like to listen, but they've sometimes got the answer first. So it's, you know, genuine listening to the bush would be important. If we could do that, that would make a significant difference. And as I said, I'd go back to my low care model. I think low care / retirement living is some sort of model that's not aged care, allows you to almost do a co-op of the home care effort to create more for a community is something we should really explore. And there's been limitations around that too. You probably understand that, you know, with where home care is at the moment, it hasn't been easy to do that because the funding's individual. And so it's tricky to do that. So I think what we'll see with the new Aged Care Act coming out in July 25, we'll have the new aged care standards come out that time as well. And the other thing that'll come out of there is the recommendations from the Aged Care Task Force. So I think we'll start to see some really interesting, you know, moves. And also, along with those changes, you'll see the new home care model as well. So, and that may even mean flexing up to a level 5, because you probably understand that at the moment there's the lowest level's level 1 and we go to level 4, but there's good conversation where they'll introduce a level 5. And if that works, geez, people could stay at home a lot longer. But I'm saying the issue again geographically in the bush is a tricky one for me, unless they've got the right support around them.
Yeah. And probably my observation is coming back to that healthcare continuum, which again I know we've had countless discussions over, and the pressure that I see on that continuum is that the engagement into the healthcare system, whether it's primary or the acute health sector, or, you know, you end up in home care or as a resident in aged care, it's very fragmented, and there's no underpinning, and this isn't probably the right term, but there's no underpinning health sponsor, and there's funnels or bottlenecks in all of those systems in transitioning from one to the other. And quite often that's passed on to the resident, the patient, or the family, and they have to navigate that. Take your point, coordinating, collaborating, listening with a community. Data is one thing which drives your decision making. However, having some sort of interactivity and feedback from the end user as well as the experts in the area to work out what maps onto that community. Yeah, look,
if I could have somebody like you, Will, you'd be fantastic because you could help me navigate the system because you understand the system. But you need somebody like you. If you were my son, it'd be fantastic because you could help me navigate all the way through because you understand the acute sector, you sort of understand the allied health, and the primary sector, you sort of understand the home care, and then across to potentially aged care, respite, palliative care all the way through. So you understand the continuum. But try navigating that as an older person without a lot of support. It's tricky. It's really, really tricky. And that's the health literacy piece. You go, well, who's got my hand here? Who's walking with me? So the poor older person, dementia, what are we, at the moment about 461,000 people with dementia in Australia. It'll go to about 1.2 million by 2050. Some big numbers there. So you're thinking, gee whiz, I've got cognitive decline maybe in communities. At a point in time, trying to navigate my way through, if I'm in a hospital, I've got somebody trying to get a discharge planner trying to get me out of there. They haven't really got my hand, but they're trying to get me to move. And it's hard. And I bump into all these bloody silos along the way, and I'm not quite sure. But I think the navigator, a community rural health navigator, you could have you need to sort of take people on a journey and walk with them and make sure we can provide the best solutions for them. It needs to be, we talk about person-centred, that would be person-centred. That would make a real difference to an older person's life, knowing how to navigate your way through. Even my wife's folk, they live at Southport of all things, it's not rural and remote, but even they had no idea how to get onto the My Aged Care. It was hard for them. So navigating, I think your point's really good, and I think that's something that we should probably, one of the things out of the Royal Commission, they did talk about a care finder and what that looked like. So I think those sort of things are really needed, especially in the bush, I'm going to say, to navigate your way through that complex maze of all these acronyms and all these different things. You're like, what does it all mean? And so I think we've got to have somebody who can walk beautifully and respectfully with that older person and their family.
Whether it's terminology driven or not, and I wouldn't die on the hill on it, the reason I love a health sponsor is that it does evoke that sense, back to what you said before, is someone living their best life. You feel like someone's in your corner and they've got a dog in the fight with you to navigate what is a complex system. And you're right, siloing is absolutely an issue. Every aspect of that healthcare continuum is on different drivers, whether it's length of stay or care minutes or whatever that looks like. A collaborative approach, even within the healthcare system, has to happen.
Yeah, that's exactly right. So I would ask, people like you, Will, and the group at Statham to think more about how do we create that. So if we could go back to government, your question, Jayden, it's like, I reckon if we could find ways to navigate and walk with people, really listening and respectfully, I think it could make such a difference. Because the silos are terrible. It's hard. It's bloody hard to navigate your way around. So,
Jace, the silos are potentially a function of the funding model. So you have primary care and aged care funded by the feds, and your hospital care is by the state. Do you think we'll ever get to the point and have the political will, is what has been discussed, to actually have a one funding model? Do you think we'll ever get there?
Look, I don't know. I probably would suggest not, but I think if you could create collaborative, relationships, good people like Annette Scott at the Toowoomba Hospital, if you can have a sort of an understanding of how you support each other, I think it's got to be through collaboration. That's where I'd point to it. If you could better collaborate and have, sort of an honesty and a trust inside that everybody's going about it the right way and the effort is consistent, because what happens, unfortunately, is that the hospital can end up with all the trouble. And I think that's unfair too. Hospitals are very good at doing acute care, emergency care. So we've got to be very mindful that we've got to sort of unplug or de-burden the hospitals from having a large cohort of older people. I hate the word, but call it bed blocking. Holding up acute beds, which sort of suggests to me that we need better respite, we need better navigators, and we probably need better investment in our community, especially in the bush. As I said, it's not cheap to build, but we do need different models, alternative models to just the straight aged care or the straight home care. I think there's something in between. It could point to retirement, it could point to home care and some sort of model that could work really, really well. So I think I've answered that in a roundabout way, but it starts with collaboration and really good relationships. That's the bottom of it. If you can do that, there's nothing worse when you're pointing fingers at each other. It doesn't get anywhere, and I think that's the danger of this, where you don't want the states and feds banging against each other. You want to be working for the common good.
Mate, we've covered a lot of territory in a short time. Is there anything we haven't touched on that you wanted to add?
No, look, I think, the work we all do collectively, both you, Jayden and Will, is so important in our communities. I think, let's continue to listen. Let's continue to innovate. I think innovation's got to be there. You spoke, Will, about data. I think data's got to be there somewhere. But we've just got to be really respectful and mindful of the effort it's going to take, and then making sure that it's sustainable. I think funding has to be, sustainable for the bush. I think some of the issues which government now is touching on is the modern monash methods have been problematic for the bush. Places like Chinchilla are categorised as a 3. It sort of says it's the same category as in Metro Brisbane. It doesn't make sense, does it? So funding, I think we've got to make sure we've got funding efforts, and I know there's a review underway on that particular methodology. And if I could, even talk about places like Broken Hill, which is in the middle of Australia, is basically has the same classification as something in Sydney. Doesn't make much sense, does it? So there is a review, and that's to do with funding. I talk about sustainability. I think, we've got to make sure we look after the bush in a good way, but some of the regional towns are pretty disadvantaged when you look at this particular model. And credit to the government. The government's rolling up their sleeves and saying we'll review it. It was based on the GP model. That's where it originally came from, to sort of incentivise GPs to get out into the bush. And so it worked, but all of a sudden, when the big townships come along, it doesn't seem to work that well. So I think advocacy and then a reasonable approach from government would solve some of the issues around sustainability as well.
Is there a better geographical distributive split to double down on the Triple M model? Is there a better split that you've seen in your travels around the world, or is that as good as it gets and we just need to dial the finer knobs?
Look, Australia, look at the size of the joint. It's bloody enormous. I just referenced the Netherlands. It fits into Chinchilla almost. It's pretty small. This joint, it's sort of, you get on train and go for an hour and you're done. You're in the water. Australia's huge. It's enormous. And I think these thin markets, as I said, how do we create sustainability within these communities? So I think new models, I think innovation, listening, partnering with community, getting all the levels of government to work together. But we do approach it in a funny old siloed way. There's like almost a mind shift that has to happen for us to create our best communities. I really do. So, we're in there. We love it. As I said, we love the work you both do, and you do wonderful work. So I think keep understanding the regional and remote communities is the key thing. Understand that the solution that works in Metro won't work out in the bush. We've got to think about how do we support people to live their best lives, and if we can do that, we'll all be in good shape.
Jason Eldering, thank you for your time, your support and your leadership.
Good on you. Thanks, guys.
Mate, I'm just going to add one last thing. I look forward to I'm going to look forward to the day that your two passions collide and every SCC facility has a 9-hole golf course.
Mate, it's underway.
Thanks again, mate.
Thanks, guys.
Stay connected with the conversation about enhancing livability through sustainable healthcare solutions for regional Australia. Visit statum.com.au/podcast to learn more, connect with us and join the movement towards a healthier future for our regional communities.